Study Session 12, Healthcare Institution. Introduction. In this study session, we will examine health from sociological perspective and explain the relationship between health and society. Learning outcomes. When you have studied this session, you should be able to 1. Define health from sociological point of view. 2. Show the relationship between health and society. 3. Discuss the 4 main sociological theories that attempt to conceptualize health and illness. What is health? From the sociological point of view, social factors contribute to the evaluation of a person as healthy or sick. How then can we define health? We can imagine a continuum with health on the one hand and health on the other. In the preamble to its 1946 Constitution, the World Health Organization (WHO) defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. Lively and Clark, 1965. With this definition in mind, the healthy end of our continuum presents an ideal towards which we are oriented rather than a precise condition that we expect to attain. Along the continuum, people define themselves as healthy or sick on the basis of criteria established by each individual, relatives, friends, co-workers, and medical practitioners. The relativistic approach to health allows us to view it in a social context and to consider how it varies in different situations or cultures. Twaddle, 1978, Walensky, 1990, and Schaffer and Lerm, 1997. Health and society. The health of any population is shaped by the traits of the surrounding society. Massinius, 1995. This can be viewed in different ways. People judge their health relative to others. Standards of health vary from society to society. Dubas, 1980, 1965, points out that early in this century, yaws, a contagious sick disease, was so common in tropical Africa that societies there considered it normal. In that context then, health was a matter of having the same disease as one's neighbors. People pronounced as healthy, what do they hold to be morally good? Members of our society, especially men, consider a competitive way of life to be healthy because it fits in with our culture mores. This is so despite the fact that stress is related to health, disease, and many other illnesses. Contrarily, some people who object to homosexuality on moral grounds claim that this sexual orientation is sick. Enough though it is quite natural from a medical point of view. In short, ideas about good health constitute a type of social control that encourages conformity to cultural norms. Cultural standards of health change over time. Early in this century, some prominent physicians condemned women for enrolling in college, claiming that higher education placed an unhealthy strain on the female brain. Furthermore, some specialists denounced masturbation as a threat to health. Today, however, such notions elicit little support from the medical community. Conversely, few physicians 50 years ago recognized the dangers of cigarette smoking and practice that is now widely regarded as a threat to health. Health relates to a society's technology. Members of poor societies routinely contend with malnutrition, poor or non-existent sanitation, and all sorts of infectious diseases. As industrialization raised living standards, conceptions of health correspondingly rose. Industrial technology, on the other hand, creates new threats to health. For instance, rich societies have the capacity to endanger health by overtaking the world's resources as well as generating various forms of pollution. Health relates to social inequality. Every society on earth unequally distributes the resources that promote personal well-being. The physical, mental, and social health of wealthy women and men in the United States is far better than that of poor people. The pattern starts at birth, with infant mortality highest among the poor. Affluent people also live longer than poor people do. Theories of health and illness. Several theoretical approaches offer a range of insights into health and treatment of illness, such as the ones explained by Parsons 1972-1975, Siegel 1976, Sear 1990, Abbott and Walley 1990, Schaffer and Smith 2005, and a host of others. It is therefore pertinent to discuss the four main theoretical approaches to understanding what health is and what illness is. 1. Functionalist approach. Illness entails at least a temporary description in a person's social interactions, both at work and at home. Consequently, from a functionalist perspective, being sick must be controlled so that not too many people are released from their societal responsibilities at any one time. Functionalists contend that an overly broad definition of illness would disrupt the workings of a society. Sickness requires that one takes a social role, even if temporary. The sick role refers to social expectation about the attitude and behavior of a person viewed as being ill. According to Pearson's theory, physicians function as gatekeepers for the sick role, either varying a patient's condition as illness or designating the patient as recovered. The ill person becomes dependent on the doctor because the latter can control valued reward, not only treatment of illness, but also excused absence from work and school. Person suggests that the doctor-patient relationship is somewhat like that between parent and child. Like a parent, the physician helps the patient to return to society as a full functioning adult. There have been many criticisms of the concept of sick role. First, patients' judgments regarding their own state of health may be related to their gender, age, social class, and ethnic group. Second, the sick role may be more applicable to people experiencing short-term illnesses than those with recurring long-term illnesses. Finally, even simple factors such as whether a person is employed or not seem to affect willingness to assume the sick role, as does the impact of socialization into a particular occupation or activity. Corey, 1993. Nonetheless, socialists continue to rely on Pearson's model for functionality analysis of the relationship between illness and social expectation for the sick. Nonetheless, sociologists continue to rely on Pearson's model for functionalist analysis of the relationship between illness and social expectations for the sick. 2. Conflict approach. Functionalists seek to explain how healthcare systems meet the need of society as well as those of individual patients and medical practitioners, but conflict theorists take issues with this view. They express concern that the profession of medicine has assumed a preeminence that extend well beyond whether to excuse a student from school or an employee from work. Conflict theorists use the term medicalization of society to refer to the growing role of medicine as a major institution of social control. McKinley and McKinley, 1977. Social control involves techniques and strategies for regulating behavior in order to enforce the distinctive norms and values of a culture. Typically, we think of informal social control as occurring within the families and peer groups, whereas formal social control is carried out by authorized agents such as police officers, judges, school administrators, and employers. However, viewed from a conflict perspective, medicine is not simply a healing profession. It is a regulating mechanism as well. How does it manifest its social control? First, medicine has greatly expanded its domain of expertise in recent decades. As the medicalization of society has proceeded into the 21st century, physicians have become much more involved in examining a wide range of issues, among them sexuality, including homosexuality, old age, anxiety, obesity, child development, alcoholism, and drug addiction. The social significance of medicalization is that once a problem is viewed using a medical model once, medical expert becomes influential in proposing and assessing relevant public policies, it becomes more difficult for common people to join the discussion and exert influence on decision making. It also becomes more difficult to view these issues as being shaped by social, cultural, or psychological factors rather than simply by physical or medical factors. Starr, 1982. Kaplan, 1989. Second, medicine serves as an agent of social control by retraining absolute jurisdiction over many healthcare procedures. It has been attempted to guard its jurisdiction by placing healthcare professionals such as nurses, midwives, outside the realm of acceptable medicine. Despite the fact that the midwives first brought professionalism to child delivery, they have been portrayed as having invaded legitimate field of obstetrics. 3. Interactionist approach. In examining health, illness, and medicine as a social institution, interactionists generally focus on micro-level study of the roles played by health professionals and patients. They emphasize that the patient should not always be viewed as passive, but instead as actors who often shows a powerful intent to see the physician. Zola, 1983, Alonso, 1989. Sometimes patients play an active role in healthcare by failing to follow a physician's advice. For example, some patients stop taking medications long before they should. Some take an incorrect dosage on purpose, and others never even fill their prescriptions. Such non-compliance results in part from the prevalence of self-medication in our society. Many people are accustomed to self-diagnosis and self-treatment. On the other hand, patients' active involvement in their health care can sometimes have very positive consequences. Some patients read books about preventive health care techniques, attempt to maintain healthy and nutritious diets, carefully monitor any side effects of medication, and adjust dosage based on such perceived side effects. 4. Feminist approach. Feminist sociologists point out that health is an area of central concern for women, yet there is a historical pattern of the medical field concentrating primarily on women's reproductive potential, overshadowing a diversity of other health and illness issues. For example, it is suggested that women patients and their doctors have very different views about pregnancy and childbirth. Women see pregnancy as a natural phenomenon, while doctors see it as a medical problem. Graham and Oakley, 1981. Medical practice is based on the assumption that doctors have access to a scientific body of knowledge about childbirth, but doctors deal mainly with illness and they tend to treat pregnancy as if it were a sickness. While radical feminists emphasize the ways in which medical ideology is used to control, Marxist feminists point out inequalities in the health system and the control that the state holds over the field. Though women are the majority of workers in the paid health care scheme, they are concentrated in the lower paid and lower status job as nurses and as general practitioners compared to administrators or physician specialists. Another key feature of the medical field is the dominance and control that doctors have over health workers such as midwives and nurses. Another key feature of the medical field is the dominance and control that doctors have over health workers such as midwives and nurses. This is again based on the perception of their advanced and superior knowledge. The role of nurse within the home also generally falls on the women in the families. They play the major role in caring for the sick, the disabled, the elderly, and other dependent groups. Graham, 1987, argues that much of routine domestic labor within the home is about health maintenance. Women are responsible for the health education of their children. They are generally the ones to nurse the sick ones back to health, to arrange the medical appointments, and to decide whether someone is sick enough to miss school or work, or have to be taken to the hospital. Whether they focus on the control of women by male health practitioners or on the inequalities in the roles within the healthcare system, feminists have advanced our knowledge of women as primary consumers of, as well as the main workers in health services. Study session summary. In this study session, we discussed health from a sociological point of view. We also established the relationship between health and society. We also established the relationship between health and society. We also examined the four main theories of health and illness. This include functionalism, conflict theory, interactionism, and feminist theories. All this offer a range of insight into the social context, shaping definitions of health and treatment of illness. That ends study session 12 and SOW202. Thanks for listening.